Anna Marie Stith Rose, a 33-year-old black woman, was 41 weeks pregnant when admitted into a hospital in Boston, Massachusetts. She was given medication to induce her labor, was sent in for an emergency C-section, and gave birth to a healthy baby girl named Trinity. Unfortunately, shortly after delivery, Anna Marie displayed symptoms of hemorrhage, was admitted for surgery, but tragically suffered brain damage and died after a 4-day coma, never getting to meet her daughter. Her husband, Andre, told Amnesty International that his wife's pleas for help went unheeded, and her last words were, "Andre, I'm afraid." Saying Anna Marie's story is unique would be far from the truth. The September 2016 issue of the journal Obstetrics and Gynecology explains that while globally we are making strides toward reducing maternal mortality, the United States, disturbingly, is not. Researchers have found that Texas's maternal mortality rate was a national and international embarrassment, with rates doubling over the last 2 years. What's even worse? The rate of black mothers dying in Texas and in this country is even more pathetic. Vox on January 21st, 2017 explains that black women die 4 times as often as white women in childbirth, a ratio, as told by the New York Times on August 6, 2016, that has remained static since 1915. In states like DC and Mississippi, we are losing black mothers at rates that rival sub-Saharan African countries. For black women in the US, pregnancy complications are the 6th leading cause of death. And that is abhorrent. Because bearing children shouldn't cost women their lives, it's imperative that we address the status quo of maternal death in the US for black women, why we are facing these complications, and how we solve this issue. Because black mothers should no longer fear that postpartum will become post-mortem. From 1990 to 2015, the UN created 8 Millennium Development Goals. And one of these goals demonstrated a rousing success. The global maternal mortality rate was finally decreasing, until the US stopped submitting its data at the end of 2015. Or were we too embarrassed to report? Let's address the status quo of maternal death in the US and where black women fit. Maternal and Child Health Journal, January 2017, explains that the United States is one of the few wealthy countries in the world where the maternal mortality rate is increasing, nearly 27% between 2000 and 2014. Other countries since 1990 have been decreasing, like South Korea, Germany, Ghana, and Chad. And because the maternal mortality rate has a direct correlation to the state of health care in that region, it's clear that the state of maternal care in the US is in crisis. Now, for black women, the maternal death rate rose from 34 deaths for every 100,000 live births in 2007 to 42.8 deaths in 2011. During the same time period, the maternal death rate for white women only increased by 0.7 percentage points. This disparity is far too great to ignore, furthering the notion that black women still don't get the treatment they deserve as mothers and as people. Researchers have found that black women are inherently more likely to have underlying pregnancy complications. So then why are black mothers dying? There are 3 prudent factors: OBGYN deserts, increased vulnerability to C-sections, and increased stress due to racial bias. First, black women are experiencing gynecological healthcare deserts, which limits their access to reproductive health care. Shape magazine on October 25, 2016 elucidates that nationally, there's an OBGYN shortage, leaving on average 1 gynecologist responsible for nearly 3,400 women. But for black women, especially black women using Medicaid, there are even fewer doctors than that average, even willing to see them. Second, black women have an increased vulnerability to C-sections, leading to an increased vulnerability to a fatal infection. The Nation on February 15, 2017 reveals that the WHO's ideal percentage of C-sections is about 10 to 15%. Yet for black women in the US, a staggering 36% of deliveries result in a C-section. The consequence? When compounded with OBGYN deserts, high C-section rates, and the inability to trust Black women's bodies, the result is that Black women are now 10 times as likely to die from these complications. Finally, Black women are more likely to experience health issues following deliveries due to increased stress, particularly from facing racism daily. According to the Journal of Women's Health on May 26, 2016, unlike other races of women, Black women experience drastically higher levels of cortisol, or the stress hormone. These stress levels are the leading cause of pregnancy complications, including heart disease, high blood pressure, and other illnesses that attribute to the early death of mothers. This only illustrates that racism can be deadly in every scenario, especially in the wake of bringing new life into the world. The US, who spends more money per capita than any other developed nation on healthcare, has one of the most sophisticated healthcare systems in the world. And we still have iniquities. Black women are still dying from treatable maternal disease. And thinking of maternal care as a human right creates a pathway to solutions, which are threefold: increasing OBGYN access, tackling implicit bias, and advocating for Black mothers' lives. To begin, Fusion on March 3rd, 2017 suggests that lawmakers can help quench these OBGYN deserts. For example, last month, U.S. Representatives Jaime Herrera Beutler, a Republican from Washington, joined by Michigan Democrat John Conyers, have introduced the 2017 Preventing Maternal Deaths Act to help identify specific solutions to connect Black American women with the health care that they deserve. Representative Conyers writes in his March 2nd press release, "This shouldn't still be an issue in 2017, which is why we must act now. I urge all of you to add H.R. 1318 to your list when calling your representatives." Second, even if we increase OBGYN access, we must tackle the implicit bias present in our maternity care system. To combat this, the Association of American Medical Colleges is beginning unconscious bias training for health professionals, otherwise known as the Everyday Bias Workshop. This workshop helps current and future physicians identify their own biases toward race and sex and how it affects their work as a health professional. If your university has a medical school, take this to its administration, or use your speech skills, take the Train the Trainer course, and host your own workshop. You could be training the next OBGYN that could save multitudes of Black mothers' lives. Finally, we must advocate for the voices most silenced, Black mothers that we are trying to protect. For starters, you can turn your support to Black Mamas Matter, a partnered initiative for the Center for Reproductive Rights and Sister Song Women of Color Reproductive Justice Collective. They've created a toolkit in order to help distill outcomes on conversations about race, reproduction, parenting, and rights into concrete steps to improve maternal care for Black mothers. You can find this entire PDF on the Center for Reproductive Rights website, or find me after the round or before awards. I have plenty. You can also take one of my resource cards with websites that are currently combating Black maternal mortality. Take a card, visit a website, and start advocating today. After I leave the circuit this year, I plan on going to medical school and caring for Black mothers as an OBGYN. And I need their voices to be heard in the fight for Black lives. Because as Counterpunch on September 30th, 2016 explains, these women aren't dying because of untreatable disease, but because we've yet to decide that their lives are worth saving. Trinity will unfortunately live in a world without the care of her mother, and it is tragic that Anna Marie's life could not be saved. But now that we understand the status quo of maternal death in the US for Black women, its factors, and its solutions, we can now protect more mothers like Anna Marie, so that death is the last thought these women have when bringing about new life.